Hello there. I would like to share one more interesting case from the diagnose, the creating of the digital smile design, to the planning of the aligners orthodontics, and then finishing with the post ortho quality control where we can evaluate the outcome. Okay, let me put a little bit smaller here. And here we can start evaluating our patient. She has a canted smile, okay? And for us to understand here, if we need to extrude the second quadrant, intrude the first, the best way we can do this is creating a smile design, okay? We start with the lines of the frame. So the frame, we can start understanding where it is the ideal incisal edge, the incisal borders of the upper teeth, then the gingival margins, the midline of the face, the proportion. And with this line in mind, we can start placing our design, okay? So we can actually visualize these in patient's face, okay? So here we can translate, we can export these images to patient's face, and with the positioning of the design, we can first to do what we call virtual mock-up. Okay, this is something we do when we are planning to evaluate if this is good according to patient's face, if these differences here is going to look good in her face, and then as soon as we understand, okay, we like the design, this is something we agree that is good for this patient, then we can start understanding the needs for the case. Okay, in terms of orthodontics, when we check here, let me put bigger, when we check the overlapping between the design that we already validated with her face and the initial position, we can start understanding the needs for this case, okay? And the most challenging movement here is on the first quadrant, where we need to do this important intrusion. Not only intrusion, also an expansion, but we are talking here about, in this one that is a little bit bigger, almost 2 millimeters in terms of intrusion, almost 2 millimeters, okay? This design, now I'm going to stop a little bit and we're going to move to another software, the Clincheck, where we're going to use this design in white to plan the orthodontics, and I'm going to explain a little bit more about the strategy that we use to achieve this amount of intrusion, okay? Just a second. We are back, and now we are inside the Clincheck, the software where I am going to create our strategy to make it happen. This design and this idea, this planning that we did in advance, so we could approve with the patient and approve with the interdisciplinary team. And now that everything is approved, I have here in the software the same design we can see here in Nemotech software in white, okay? Here we are seeing this transparent blue inside the Clincheck, and I can activate by using this button, okay? So here we have the final position that we plan, okay? The initial position. So the first strategy that we use for cases like these that we need to intrude the posteriors was the sequential movement, okay? You can see that we start intruding the anteriors, which is the most urgent area according to aesthetics to the patient, okay? And then when we finish intruding the anteriors, we start first intruding the first premolar, and then the second premolar, and then the molar, first molar, and then the second molar, okay? In the final position, you can see also another important strategy, which is the overcorrection, okay? Remember that we measure in the software, Nemotech, the amount of intrusion we need to do in this area, around 2 millimeters, okay? A little bit less. And here we are intruding more, 2.4, 2.6, 2.7. We are moving more than the design is asking as an overcorrection, so we can create enough force system with the plastic to achieve the amount of intrusion that we need, okay? But for cases like these, I already presented these in a previous video, we have a lot of papers showing that to have a predictable intrusion movement with aligners, it's up to 0.5 millimeters of intrusion. Between 0.5 and 1, it is moderate, and more than 1, it's considered complex. So we have all the intrusion in this area more than 1 and much more than 1. So even applying sequential movements and even adding overcorrection, in this kind of case, we are still recommending the use of skeletal anchorage, that I'm going to present how we plan it and how we use for this case to facilitate the insertion of the TADs, the implants, in the best position possible so we can have the best anchorage system for this case to help in these intrusion movements. Just a second. So here we are back again to Nemotech software after we plan the Clincheck to plan the TAD guide, okay, where we are going to use again the design in white that we use to guide the Clincheck and to test drive with the patient. And now we have two important, very important information to plan the positioning of the mini implants the most accurate way possible so they can stand there very stable and without risks for all the teeth. Okay, we have the initial position, of course, but also the final ideal position. With these two positioning here and having the integration of the CVCT that we can bring together, we're going to segment the roots. Okay, so we have the roots in their final position in yellow, the roots in the initial position in green. Okay, so you can see here that the initial position is being guided by the in green by the STL model, okay, and the yellow position, which is the final, by the design. Okay, this way we can see all the movement that the roots they're going to do, and sometimes even adjust a little bit, so we can position the TAD where it's not going to contact with any of these roots. Okay, so now I'm going to bring the TADs where we place them, because of course here between the premolars we don't have enough space. And looking here in the occlusal view, let me remove the model for a while. Okay, we can start checking all the details, and that in the position we're going to insert, I'm going to move here, okay, so we can see that is not contacting any roots. Okay, let's check here for a while. Look, not contacting initial and final, and here in a safe position in the mesial of the premolar. Okay, so this planning, with this planning in mind, we are going to manufacture the guide, okay, that we're going to use to place the TADs with the best accuracy possible. Okay, and this was the strategy that complements the staging and the overcorrection that everything was guided by the approved design. So now let's take a look in the outcome of the first set of aligners with the Post Ortho Quality Control. The Post Ortho Quality Control is a moment where we can brainstorm again about what we need to do with the case, if it's possible to finish with orthodontics, if we need more ortho with additional set of aligners. And the best way to do this is creating this visual content, this overlapping between the models. So we have here the initial model, now it is in orange, okay, because it's not the actual model anymore, so now it's a different color. The design never changes, here in white, and it's guiding everything we're doing. And now we have the final position after the first set of aligners. Okay, let me remove the design for a while so we can see the huge difference we had in this first quadrant in terms of intrusion. Okay, so the use of the TADs, we can see one here, okay, and the other one in the palatal, okay, where it was planned, where you saw in the guide that I just presented to you, okay. Here, it was used at biomechanics that elastic passed from one TAD to the other, passing over the plastic, the aligners, so it is creating a very, very good intrusion force for this first quadrant, okay. And looking back here, the difference between initial in orange and after the one set of aligners, in this pink color, okay? And to understand if more ortho is still needed, okay, we can bring the design again and we can review here. Okay, let me move. So it's very, very close to the position that we planned. If we need to be very picky here, I would say that maybe a little bit more of intrusion, it's going to be even better, mostly in the second molar. It's normal because it was the last one that we intruded, okay? So it's far from the area of the skeletal anchorage. So it's normal to have less predictability here. So we need to overcorrect a little bit more, okay? Looking in this frontal view, I would say that we still need to intrude a little bit more these anteriors, okay? So here, let me adjust the zoom. We still need some ortho, okay? And the midline, of course, ideally we should change a little bit. So my answer to the question, do we need more ortho? It's yes, okay, for the upper arch, yes. And here we are just discussing about the upper arch, of course, many other factors we need to consider. For example, the occlusion, okay, that is not good yet. And this is something that now in the additional set, we're going to adjust these. We need to extrude a little bit posteriors, intrude more the lower anteriors, okay, so we can accomplish the outcome that we plan in this design here in white, which is this the final occlusion we are targeting for this case, okay? So this case is not finished yet. This is our conclusion, and but the outcome for the first set, we could solve the most challenging movement almost in 100%, which is the intrusion of the first quadrant, okay? If you want to learn more about these strategies that I didn't have the time to explain with details, just send me a message. I can help you there. I have many suggestions for you in terms of courses, in terms of congresses, and a lot of content that you can study to learn more about these biomechanics and these workflow that we are using, that is guided by the face, guided by Airway concepts, and of course, guided by the function and the TMJs. Hope you like it. See you soon. Bye-bye.